There are rare occasions when a mother may have done everything she can to prepare to have a successful breastfeeding relationship with her baby, but something causes unavoidable challenges. When plans A, B, and C don't improve the breastfeeding situation, what are plans D, E, F, and maybe G? I'm Rose Davinia Jackowitz, an international board-certified lactation consultant and lactation consultant at Kaiser Permanente Outpatient Lactation Clinic in San Diego, California. Today we are discussing options for when breastfeeding doesn't go as planned. This is the Boob Group, episode 26.
Breast milk, it does a baby good.
Silly daddy, boobs are for babies.
I make milk. What's your superpower?
If my breastfeeding offends you, put a blanket over your head.
Dairy diva. Don't be lactose intolerant. Nursing nature's own breast enhancement.
Meals on heels.
Whoever said there's no use crying over spilled milk never had to pump.
Breast milk. All others are inferior.
Whatever your point of view, we're here to support your breastfeeding goals. We're the Boob Group, because mothers know breast. Welcome to the Boob Group, broadcasting from the Birth Education Center of San Diego. I'm your host, Robin Kaplan. I'm also a certified lactation consultant and owner of the San Diego Breastfeeding Center. At the Boob Group, we're your online support group for all things related to breastfeeding. Have you checked out our fabulous articles on our blog yet? We have several moms who have offered to blog about their breastfeeding experiences for the Boob Group, and I was completely blown away by their stories. If you are interested in sharing your breastfeeding stories, feel free to contact me through the link on our Boob Group website. Today, I'm joined by three lovely panelists in the studio. Ladies, would you please introduce yourselves?
Hello, Robin. My name is Tamar Blanco. I'm 34, and I work at the Housing Commission. And I am the mother of two children, ages 6 and 2 months old.
Hi, I'm Michelle Reed. I'm 31. I'm a wife and a mother. That's kind of my job. And I have
Those are important jobs.
Yes. And I have 5 children.
Wow. How old are your children?
I have an 11-year-old, 9-year-old, 7-year-old, 4-year-old, and 7 weeks.
Nice. Thank you.
Hi, I'm Heidi Runge. I'm 33. I'm a paralegal. I have one child, and he's 9 months old.
All right, welcome to the show, ladies. Before we get started with today's topic, here's a question you all had for one of our experts.
Hi, Boob Group. My name is Karen, and I'm calling from Santa Clara, California. And I have a question about my 4-month-old. I recently noticed that her poop has changed color. It's sort of a green color, and it smells different. And I've always heard that if the poop was green, that's possibly a bad thing or that she has a cold. But she seems happy all the time, and there really isn't any issue. So I'm just wondering if it's a change in the fact that she's 4 months, or if there is something that I should be concerned about. Please let me know. Thank you.
Hi, this is Dr. Johnson. Having green stools isn't necessarily a sign of infection or a problem. Certainly it can be related to what the child has eaten, although at 4 months that's usually pretty limited. But colors you should worry about with your poop are red, black, or almost white. Those are more telling signs of a problem. So as far as the green stools, I wouldn't worry a bit. Keep feeding her, and if she's already started on any solids, that can certainly affect the color of her stools and the aroma of them too. So hope that answered your question, and if you have any more, let us know. Bye-bye.
If you have a question about one of our topics mentioned on our shows, call the Boob Group hotline at 619-866-4775. Today on the Boob Group, we're discussing what a mom can do when breastfeeding doesn't go as planned. Our returning expert, Rose Davinia Jackowitz, has been an international board-certified lactation consultant since 1984 and is a lactation consultant at the Outpatient Lactation Clinic at Kaiser Permanente San Diego, which just celebrated their 10-year anniversary, correct?
Actually, 12 years.
Oh, 12 years. My goodness.
12 years.
That's fantastic. So thanks for joining us, Rose, and welcome back to the show.
Well, I'm very happy to be here. Thank you.
So, Rose, what can a pregnant mom do to set herself up for optimal breastfeeding success?
Well, actually, there's many things she can do. One of the first things, I think, is finding good books to read on breastfeeding. But above and beyond that is when you go in for your prenatal visits with your OB, make sure that a thorough breast exam is done to identify any potential issues with your breasts, your nipples, potential issues with previous breast surgery. Also, I think prenatal breastfeeding classes, as well as a prenatal consult. If you have concerns that maybe something might not be right, go in for a prenatal consult with a lactation consultant, and you can get a lot of information that way.
Absolutely. It's interesting that you mentioned talk to your healthcare provider prenatally about your breasts. We just had an episode a couple of weeks ago about insufficient glandular tissue, and the women said that the only reason they found out that they had it was after they had their baby, but they always kind of knew that there might be an issue, but it was never brought up by their OB/GYN. I don't know if any of them had seen midwives. I can't remember, but it's an interesting thing that you mentioned, that it could be something to talk about before you've had your baby.
I think over the years I've had women who've said, well, yeah, they looked at my breast, but nobody ever said anything. Nobody ever addressed my inverted nipples, other than the fact my favorite was a woman who had inverted nipples, and her doctor said, don't worry, when your baby's born, they'll pop out.
Like they're done, like on a chicken.
Exactly. And needless to say, they didn't pop out.
Yeah. Ladies, did you do anything prenatally to prepare for breastfeeding?
I had taken a breastfeeding class with my 6-year-old daughter before she was born, but this time I just didn't get around to it. I just thought it was going to happen, and I thought, well, I had problems the first time, but this time it'll be different. So I was a little naive.
Well, no, not necessarily. You're hopeful. Thank you, Tamar. How about you, Michelle?
I read lots of books. Anything that I could get my hands on. Inside the doctor's office, I'd grab things. And I also found it very helpful that in magazines, when you'd see pictures of mothers breastfeeding, I surrounded myself with pictures of moms already breastfeeding, just to give myself a positive outlook. Like, it's been done, it can be done, I can do it. So
I've never heard of that idea, but I love it. That's wonderful. And another reason also to attend a breastfeeding support group while you're pregnant too, just to surround yourself with other breastfeeding moms. How about you, Heidi?
I also attended a prenatal class on breastfeeding. I had books. I started books. I didn't necessarily finish books, which may have been part of the problem.
Rose, what are the signs that a mom should look for to indicate that there are some breastfeeding challenges going on? Because sometimes they're not so obvious.
And that's a very good question. Some of them, things like, for example, history of infertility. Depending on the reason for infertility, sometimes you may have a low milk supply based on the type of infertility, like PCOS, which is polycystic ovarian syndrome, which is probably the most common cause of infertility. Probably 50% of those women are known to have a low milk supply. So knowing that up front, breast surgery, what type of breast surgery, augmentation, reduction, inverted nipples, knowing those things as well. Another example is type 1 diabetes. Many moms do not realize or they're not told that it's common to have a delayed onset of milk supply when you have type 1 diabetes. So knowing that up front, you're not so surprised to find out that your baby may have to have a supplement because of low blood sugar or because your milk supply doesn't fully come in until 5, 6, 7 days.
Absolutely. And what assistance is typically available in the hospital or once the mom is back at home?
In the hospital, there should be a lactation consultant that is available to assess you, and she will go through your history, asking you questions such as any problems getting pregnant, did your breasts get bigger during pregnancy, any history of breast surgery, any medical problems, allergies, things like that, to fully assess, are you at risk for having breastfeeding problems or milk supply issues? And then if you are identified as having issues, maybe your baby's born early, and your milk supply hasn't fully come in by the time you go home. Hopefully there is a lactation clinic or a lactation consultant like Robin that you can go to see after going home from the hospital. Most moms and babies are seeing their pediatrician within 24 to 48 hours of going home from the hospital. Should almost be the same for lactation if you are identified as having what I call risk factors.
Absolutely. Ladies, when did you first know that you needed some extra breastfeeding assistance, some additional support?
Well, My baby was 4 days old, and in the hospital they said that he had lost already more than 8%, and that was really scary for me. So they just automatically assigned a lactation nurse to me, and she was able to come by and assess the problem and how I could solve the problem with spoon feeding and by pumping. And so that was a very good help.
That's fantastic, Tamar. Thank you. How about you, Michelle?
Day 3, when we had to go back for the baby check, she had already lost way too much, and they kept having us come back every 3 days or so, and they checked her sock, and she was tongue-tied, so she had to go in for that. Like, we went in on day 3, and day 4 she was clipped.
Wow.
So then we kept coming back to the lactation specialist. We were at the hospital a lot.
Yeah. Were you going back for weight checks at the hospital? Or
Yes.
Back? Okay.
Yeah.
How about you, Heidi?
Day 3, we had a doctor's appointment, and that was a Friday, and he had lost, I believe, over 10% of his weight. He was born at 8 pounds 9 ounces, 8'1" when he discharged to the hospital, and then 7'10" on day 3, which is quite a bit. So my milk still hadn't come in, and so we knew there was an issue, so he had suggested supplementing. But then, of course, it was the weekend, and I had a meltdown, and I called you. And day 6, I got help.
Yeah.
So,
Rose, and just to clarify, too, because, we're talking about lactation educators and specialists in the hospital, and what is the difference between a lactation educator, a La Leche League leader, and an international board-certified lactation consultant?
A lactation educator could be a childbirth educator, could be your postpartum nurse, is somebody who's taken a course on basic management of breastfeeding. They can help you with positioning and latch and your common problems of minor sore nipples, engorgement. A La Leche League leader is just by history has been a lay consultant, a lay person who has knowledge of helping you with breastfeeding. And some of the La Leche League leaders are, oh my gosh, wonderful. They've been doing it so long that some of them have more experience than I do. Okay, it's just they're more of a grassroots. I've been doing this for 30 years and I've been helping moms. An international board certified lactation consultant is somebody who has sit for an exam. It's an all-day exam, a very intense exam that tests her skills for lactation. But the other thing about the international board certified lactation consultant is they're specialized in your more complicated cases for breastfeeding. They go beyond your normal sore nipples, beyond your engorgement. They specialize in the problem-oriented situations.
So what should a mom expect when working with someone with those 3 different types of qualifications?
Well, first of all, asking them what their experience is. And if it's a lactation educator and you're having major problems, you might ask for a referral to a board-certified lactation consultant. Asking her, have you worked with this kind of a problem before? And if she hasn't, hopefully she'll, be open and say, I'm not as experienced in this, and let me refer you. But again, the lactation educator is more for basic common problems, as well as a La Leche League leader, and then the IBCLC is much more problem-oriented and generally has a lot more experience in dealing with the complicated cases.
Okay. And then kind of getting into those complicated cases now. So when dealing with a low milk supply, what options does a mom have to increase her supply, and what should she feed her baby until her supply increases? And I realize this is an own topic in itself, but just kind of a basic overall.
It's definitely a topic in itself. And how long do we have to talk? And again, as an international board certified lactation consultant, it kind of depends on why the milk supply is low. There's various herbs, there's various medications that can be taken, but it's going to depend on the individual mom's history, what she is allergic to, what she's capable of taking. But the first thing that moms would typically need to do is additional pumping. Hospital grade pump is my preference because it's designed to help establish a milk supply, and then adding either herbs or medications depending on the individual situation. And as far as what to feed the baby in the meantime, whatever milk you get, absolutely feed them. Any amount of breast milk is going to benefit the baby. And the World Health Organization says number 2 choice should be donor milk. And we've had more moms that have had sisters, best friends that have donated milk. There's issues with making sure their health is good because you're taking somebody else's milk, and donor milk isn't always available. The donor milk banks, it's about $3 an ounce, and that's really reserved more for preemies or your very sick babies, but that is still an option. And then the final option is artificial baby milk or formula. And again, depending on family history, milk allergies, and things like that, you might need to pick the one that's best and most appropriate for the baby. And you may need to supplement with a little bit of that until your full milk supply increases. And that's okay. That's okay to do. A lot of moms feel like they're failing if they have to use formula. And I don't want them to feel that way. We've got a special situation here, and we want to feed our babies. First thing and foremost is feed the baby, and work on your milk supply as we're feeding the baby.
Absolutely. And so Heidi and Tamar, I know that you both kind of dealt with different milk supply issues. And so Heidi, how did you deal with the situation with your son?
We started off after a consultation. We had my husband help, and we did the finger feeding with either milk that I had pumped if we weren't able to get him to latch, because we had latching problems in addition to low supply. So we did finger feeding. We did some supplemental nursing where with the kind of tube and everything. And then we did eventually, when he was about 3 weeks old, use a low-flow bottle to also give him either pumped milk and or formula. So it's kind of a combination of those things. I also was taking some supplements also to try to increase my milk supply as well. So it's kind of several things. We tried everything.
Yeah. How about you, Tamar?
Well, one of the things that really devastated me was at 2 weeks, his weight had still not gone up. And so I immediately saw a lactation consultant, and she gave me some great tips, pumping and using a low flow bottle, using the hospital grade pump, pumping every 2 to 3 hours. And she also recommended some herbs that I could take. Well, a week later, I really hadn't improved. And so that was just very, very stressful and very, it was just discouraging. So when she took a second look at me, she said that it looked like I might have insufficient glandular tissue, that I may have hypoplasia. So that was something new for me. My daughter, I was unable to breastfeed her. I was able to pump about 5 ounces for about 7 months, and I couldn't understand why that was happening. So when she told me about the hypoplasia, then it all made sense. I went on the internet and looked up as much information as I could, but that was the problem. There wasn't that much information, and I was astounded at how many medical professionals had never mentioned this to me, and how there were many lactation specialists that didn't even really know about this IGT. So the way it was explained to me is breastfeeding with IGT is like trying to produce milk without the milk factory. So it made perfect sense. And I knew at that point, if I really wanted to make it happen, I had to try everything. And so that's when I met you, Robin. A few weeks later, I asked, you were great. You came over. And so between what you mentioned to me and the other lactation consultant mentioned to me, I tried everything from acupuncture to the chiropractor, actually taking my baby to a chiropractor to help with latching. We even tried, medication and supplements. And I think besides trying everything, I think what really helped was the support of my spouse and really surrounding myself with people that were going to be supportive. And although people meant well, they didn't understand, may not have understood what I was going through. So when they would tell me, it's okay, you can just bottle feed, that was probably the worst thing that they could have told me, because it was defeating the purpose. So I would say just surrounding yourself with positive people and just trying everything, because you just never know what's going to work. And I could say that 9 weeks later, I'm now successfully breastfeeding my baby. So I'm really happy about that.
Absolutely. So Rose, when dealing with a baby who has latching difficulties, then which is a whole different beast than milk supply, what options does a mom have to feed her baby and protect her milk supply while the latch issues are being resolved?
Well, again, hopefully she's working with a lactation specialist who has knowledge in this, but there's various options in helping the baby to learn to latch. But if the baby actually is not latching, the important part will be for you to be using a pump, an effective pump that is stimulating your breast to establish the milk supply, and you're feeding your baby. Feeding your baby either by bottle, by finger feeding, and that's where the lactation consultant will sit down with you and go, these are the options that you can have for feeding your baby. You get to decide what those options are and what is going to work well for you. For some, the feeding tube does not work on the finger. The feeding tube doesn't work at the breast unless baby's able to latch.
Sure.
So it's kind of frustrating when moms are taught how to use the tube at the breast if the baby's not latching on. And so finding out what the various options are, but basically it's establishing your milk supply by pumping, feeding your baby, giving your baby time to learn. And some babies just take a little more time to catch on than others.
Yeah. Michelle, I know that you've been working on some latch challenges with your baby right now, and so what have you done to kind of work on resolving these latching challenges?
The first thing that I knew I had to do was to increase my milk supply. So I pump around the clock. In the evening, I follow her schedule, but whatever she's doing throughout the day is what I'm doing. Every 2 to 3 hours, I'm pumping. I made sure, I have to give her a bottle. And if I notice she has some cues and she's calm, if I can latch her, I latch her. It's never for very long, but just that I can still bring her back to the breast is encouraging. That's the only thing that keeps me going, hoping that maybe we can continue doing that.
Absolutely. And I mean, I recommend that often as well, Rose. Would you say this kind of almost non-nutritive sucking sometimes where the baby gets on and they're just falling back in love with the breast. And so it may not be that she's getting all of her nutrition from it at this point. Well, she is, but just not directly from the tap, essentially. But that, having the baby spend time skin to skin and at the breast and just trying can be really beneficial.
Oh, absolutely. I refer to it as comfort nursing.
Yeah, I like that.
If the baby is willing to just comfort nurse at the breast in place of a pacifier, it's a great way to transition them back to the breast for them to realize, hey, this is a nice place to be. And as they get better at nursing or as the milk supply increases, they're kind of just getting better at it. But yes, absolutely.
Well, great. Well, when we get back, Rose will discuss what to do when plans A, B, and C aren't working to solve the breastfeeding situation. So we'll be right back. And we're back. So, Rose, what is a mom to do when these initial breastfeeding plans don't work, and for some reason these breastfeeding challenges are difficult to resolve? Essentially, when plans A, B, and C haven't worked, what can plans D, E, F, and G be, and what's the most important thing to keep into perspective?
The most important thing I think to keep in perspective is it takes time for some of these babies, and to be patient, feed the baby, and again, you're working with a specialist who is giving you options on how to feed your baby and how to help the baby get to that plan A. Plan A is we're going to feed the baby at the breast. Plan B may be some breastfeeding, but we have to supplement. Plan C, so it gets all the way down to, okay, I'm just pumping and feeding. How long does it take? It varies from baby to baby. And I've seen more babies over the last few years that for some reason seem to take anywhere from 4 to 6, 7, 8 weeks to really click. And just realizing that it's not you in many situations, because as a new mom, we think it's us. What am I not doing? When sometimes it's a baby who hasn't learned to suck correctly, a baby who hasn't learned to bring his tongue forward, a premature baby who needs time to mature. But again, our number one goal is feed the baby. and protect the milk supply, increase that milk supply, and then just be patient with yourself and with your baby.
And I get this question a lot, especially for moms who are working to increase their milk supply, but is there an answer to how much breast milk does a baby need per day for it to truly make a difference in his or her health and nutrition?
I get this question also frequently, and any amount of breast milk is absolutely going to benefit the baby. It can be 1 bottle a day. When I weaned my last daughter, she had only been nursing, and she was a little older too, but she'd only been nursing once a day, maybe twice if she fell and got hurt. Within 3 months, we tripled her ear infections. So 1 feeding a day, 1 bottle a day, 1 ounce, any amount of breast milk. If you're into chemistry or biology, you can go and look at the millions of properties, infection-fighting properties and cells that are in 1 ounce of breast milk, and you're going to go, whoa, 1 ounce will benefit my baby. So don't let anybody say it has to be 50% or whatever. And again, it also goes back to you and your husband, what is going to work well for you. Recently, somebody said, if it's only 10% of his intake, is it worth it? Well, from a medical perspective, absolutely. But from your perspective, you're doing a lot of work. Is it worth it for you? And that's where I frequently sit back and ask moms, tell me what your goal is. Tell me what you want to do. We've been doing this and this and this. Tell me how you're feeling now. My job is to help make it work for you.
Okay, thank you so much. Heidi, kind of getting into, or I guess for everyone, and then we'll ask Heidi, but just, kind of looking at, so these challenges, there were lots of different stages of them and kind of finally hitting your stride. So Heidi, what would you say your final plan looked like when you had hit your stride with breastfeeding and bottle feeding and all that kind of stuff?
I think it all began when part of the plan was me just accepting what I could do and just coming to terms with, okay, I'm never going to be the one that's going to have an oversupply. I'm not going to have 100 ounces of frozen breast milk in my freezer. That's not in the cards that were dealt to me. I have to just do the best with what I have. And so I guess at the peak of mine was Asher was latching. He would latch, I don't know, maybe one side one day, one side the other, sometimes both sides. And I would pump and I would give him anywhere from 4 to 6 ounces a day, which was really good. And so I gave him he got 1 less bottle of formula a day, which in the grand scheme of things, a lot of people may not think is a lot, but like you said, it's something. And that was 1 less, bottle of formula that he had. And it was a lot of nutrients, and it was what I could give him. But a lot of it was just me not stressing out over what I could do, could not do. And I think that helped me enjoy breastfeeding a lot more too, is just coming to terms and, letting the relationship be what it was and just accepting it. So yeah, it just was really accepting that, and then, pumping, and then having him latch whenever I could get him to latch. And we definitely did the comfort nursing, like you said, whenever I could. Like, I know a lot of people would say, don't let them, for sleeping wise, just sit at the breast. And I'm like, you know what? If that's what I get, then I'm going to take it and I'm going to run with it. Because, for me, that was one of the most special times and bonding times, since I didn't feel like I got that as much at the beginning.
Yeah.
So
I find those are the hardest ones to wean from at the end too, because the first of the morning, the right after the nap or right before the nap, and right before bed, because that's the quiet space that you're in with your children. And so even if when it is comfort nursing, it's so beneficial for both mom and baby. So yeah, absolutely.
If you think about it, mother's breasts are nature's pacifiers. Pacifiers weren't around how long ago? Mother's breasts have been babies' comfort nursing forever. And if that's what is working, then that is the best thing. Absolutely.
Yeah, definitely. Tamar, going back to kind of what you had described, how long did it take you to finally build this full milk supply for your son?
9 very long weeks. I went through a lot of emotions, and there was a point where in the beginning I felt like I failed. Like I went through what you would call the 5 stages of grief, because I thought that there was a real possibility that I may not have that exclusive breastfeeding relationship. I didn't with my daughter. I was happy and proud of everything I gave to her, that 1 bottle per day for the 7 months, but it was like reliving those emotions all over again. And I read this on the internet. A mom said that, like all nursing moms, a mom needs to define for herself what a successful nursing relationship is going to be. This may mean I will give my baby as much as I can, and I will rejoice in my ability to give it. So I read that, and that inspired me. And I thought, I'm just going to keep going until I can give my baby whatever I can give my baby. I'm going to give it to my baby.
That's a wonderful quote.
It's beautiful.
Yeah,
yes,
absolutely.
It is.
And then, Michelle, I know that your baby is quite young still, and so you're definitely in this process of figuring out what's your stride, essentially. So where are you at now, and what are you working towards?
I was very excited to come today because this is part of my plan, and part of just being here today is super helpful in what I want everything to look like. Right now, she's a little bit older, so she's able to latch. It shouldn't be so much an anatomy issue as it was in the very beginning. So I'm hoping to get back to the breast. Right now, I'm just pumping and giving it to her in a bottle and comfort nursing when possible, which I can go days without doing that. And then all of a sudden she'll surprise me, and like she showed a cue, she was sucking on my arm, and I just put her to breast because I figured if she can suck on my arm, then she will do this, and she did. So, and it wasn't very long, it was a very short amount of time, but she was happy. It wasn't fighting her. It was joyful for me because I get nervous and stressful and tense when she's screaming and I'm trying to latch her, and that wasn't working. But doing it just, hopefully I am trying. I really would like to have some sort of, maybe more than 5 minutes of nursing.
Absolutely. And ladies, how important was it for you to set short-term goals rather than just long-term, I want to exclusively breastfeed, but kind of having these defining moments of, okay, I got here, now what do we do next? Heidi?
I think that's the only thing that kept me going, honestly, because I went into breastfeeding and went into, before giving birth, just being like, oh, okay, I did the class, I read a couple books or part of a couple books. This will be, everyone said it's easy, it's natural, and then my world shattered and everything, the ground fell out from underneath me. So I just had to keep going, like, okay, Robin's coming Monday, it's Sunday morning, let's make it till Monday, and then it was, okay, I've made it 6 days, let's make it to Friday, and then it was make it till next week, and then it would vary too. He might be latching really good for a couple days, and I'm like, okay, we're going great, and then, he stops, and so I'm like, you hit another wall. You're like, okay, let's not give up today. Today is what it is. Let's keep going, and let's see where we are in 2 days, and then it would be better. And then I'm like, okay, let's try to make it to 2 months. You'd make it to 2 months, 3 months, 4 months. Last time I was here, the week before was like horrible. And I'm like, great. I'm like, I'm not even going to be breastfeeding at 3 months, but you just have to keep holding on and just get through the day and just know that as in life and everything, there's good days and bad days. And that's how it's going to be with breastfeeding too, with everything. So you just have to keep holding on and just, grin and bear it really, and just try to work through it. And it usually happens where it does get better. Like you're going to be you're maybe in a lot of pain, you may, all of that, but it gets better, and, you both are learning. You're both learning, so yeah, I did 4, 6 next week, next feeding, yeah. But it was honestly the only thing that kept me going.
Were the short-term goals.
Yeah.
Okay. How about you, Tamar?
I have to agree with Heidi. It was a struggle whenever I would look at the big picture, and it was overwhelming to think, well, you have to completely breastfeed. So it was those small goals. I'm going to pump every 2 to 3 hours today. And then the next day would be, okay, I'm going to pump, and then I'm going to excuse me, I'm going to drink this amount of liquid to help with my breastfeeding. So every day I'd have a new goal. I didn't want to overwhelm myself. I know how easily stressed out I can be, and I just had a baby, so I know those hormones are a little crazy sometimes. So it was those small goals that made it, those bite-sized goals that helped me to feel like I'm in control of the situation. I didn't want to feel out of control, and I just knew that even an ounce, like Rose says, any bit of breast milk that you can give your baby is a success. So that's how I looked at it, and I didn't want to overwhelm myself with too many goals. So the smaller the goal, the easier it was to have a success.
Thank you. How about you, Michelle?
A lot of what they're saying is exactly how I felt. I think one thing that really made me start looking at the shorter goals is I had mastitis that turned into an abscess, and I had to have emergency surgery where my baby was taken from me for that night, and I had to stay the night in the hospital. At that point, I had surgeons telling me not to pump my left side at all. And then once they seen the wound and they seen how engorged they are, they're like, you have to express it. It has to come out because this is going to get worse. So once I had to do those things, then it was, I felt like, you know what, I may not be able to breastfeed, but now I'm injured. And they were telling me an unhealthy mom is not a good mom. You need to be healthy for your children. So at that point, it really slowed me down. I didn't even look at the huge picture at that point. I just focused on healing. I need to heal. And I need the milk out. So the baby's getting the milk because I have to get it out. But so I'm still on the right track. And my focus at that point was healthy baby, healthy mom. And that's what got me through that.
Absolutely. Absolutely. Well, thank you so much, Rose, for your insight into this very complicated and emotional issue for breastfeeding moms. And thank you so much to our panelists for sharing your story and giving hope to so many other moms who are out there that they can make breastfeeding work for themselves. So thank you so much. So here's a comment from one of our listeners. Her name is Jean, and she's from Riverdale Park, Maryland. Hi, Boob Group. I just love your ongoing series about you following 3 new breastfeeding moms for the first year. I recently had my first baby, and I've been listening to these episodes to get an idea of what to expect in the upcoming months. It's really nice to know that I'm not the only mom out there having issues. I recommend your show to the women in my breastfeeding support group all the time. Thanks for the great resource. And thanks so much, Jean, for writing this in. Thank you so much to our expert panelists and all of our listeners. If you have any questions about today's show or the topic we discussed, call our Boob Group hotline at 619-866-4775, and we'll answer your question on an upcoming episode. If you have a breastfeeding topic you'd like to suggest, we would love to hear it. Simply visit our website at theboobgroup.com and send us an email through our contact link, or you may visit our Facebook or Twitter pages and suggest it there as well. Thanks for listening to The Boob Group, because mothers know breast.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
Hey, mamas. Don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording, so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.